Hello, everyone, and welcome to Writers and Books Visiting Writers Series. Writers and Books is a nonprofit literary arts center in Rochester, New York. We do readings, workshops, and other literary programming for all ages. For our full schedule events, and if you'd like to know how to become a member, you can visit our website at wab.org. For this event, we're very happy to partner with the Rochester Academy of Medicine to launch this very timely and important book. Viral Pandemics explores the world of viruses as the cause of all acute pandemics since 1900, including the COVID-19 pandemic. We're happy to have both of its authors here this afternoon. Rae-Ellen Kavey, MD, MPH, is a pediatric cardiologist and public health practitioner. Author of more than 100 articles and 4 book chapters, she's currently a consultant to the NIH Pediatric Heart Network, an instructor in the Department of Medical Humanities at the University of Rochester Medical Center, and an adjunct professor in the Department of History at the CUNY John Jay College of Criminal Justice, where she teaches the epidemiology of epidemics. Allison B. Kavey, PhD, is a professor of history at CUNY John Jay College of Criminal Justice and the CUNY Graduate Center. She specializes in early modern history of natural philosophy. She has taught extensively in the history of medicine and written on the history of anatomy. She holds a doctorate in the history of medicine from Johns Hopkins University School of Medicine. We'll first hear from Rae-Ellen and Allison, and then they'll be in conversation with panelists from the Rochester School of Medicine, Dr. Lawrence Chessin, infectious disease specialist, and Dr. Bill Valenti. Thank you all for coming. I'll also mention that the book is available at our bookstore at a 20% discount for curbside pickup. We will take questions from the audience, so you can submit them in the Q&A function at the bottom of your screen. Thanks for joining us, and thank you to Rae-Ellen and Allison for being here.
Thank you, Dan. This is Rae-Ellen, and also thank you to Writers and Books and the Rochester Academy of Medicine for sponsoring this. We're really so thrilled. I am, at any rate. This is my first book, and I got my very first copy of it this morning. So great moment, really a great moment for me, and first book I've ever written with Allison, so a family effort. And I thought I'd start out just telling you a little bit about how I ended up beginning this book and Allison's involvement with it. I retired 5 years ago in the fall of 2014 from clinical practice. And I was home maybe 2 days, 10 o'clock in the morning, listening to the radio, and I hear Obama's voice talking about an international security problem related to the Ebola pandemic in Africa, and how they were lacking medical volunteers. So I thought, you know, I'm retired, I've got time, I can do this. So I went to the CDC website. They had right there, right up front, a box you could fill in, and they said right in the intro that they took care of all applications for all medical aid volunteers. Filled everything in, sent it off, didn't hear anything. Maybe 2 weeks later, I get an email saying I've been rejected as a volunteer because I'm too old, because they don't take anybody over the age of 60 because of the increased risk of mortality with Ebola. So that was the end of my career as an Ebola warrior, but it was not the end of my interest in this disease, which I really knew very little about. And the more I learned about it, the more interested I got in viruses and viral pandemics, and began teaching epidemiology of epidemics to undergraduates. And somewhere in there, my husband said, you know, I think you've got a book here. And that's how I ended up talking to Allison with her strong background in history, because I wanted the book to be grounded in the history of each pandemic. Allison, you want to talk a little bit about that?
Thank you very much to everyone for inviting us today. It's a real honor to be here. You might have noticed that I have entirely the wrong degree for this book, and you might be wondering what it is that I'm doing here with my useless PhD instead of a proper degree in something useful. I would not be chosen to be an Ebola warrior under any circumstances, I'm afraid. However, I'm here to argue for something a little bit different, which is to say that if we study the history of viruses and the history of public health efforts to control them, we can learn a lot of useful information that both physicians and public health practitioners can use to talk about today's public health efforts. And I want to speak specifically about vaccination. We believe that vaccination is the most successful approach to controlling viruses for one reason: polio. The polio virus was, of course, controlled by vaccination when it was used well. But if you look at the after effects, even of the polio vaccination, we have new vaccine-caused cases of polio in India and in Africa. And in Africa, those were the very first cases of polio. So it's fascinating that our vaccine, which solved the problem for much of the developed world, has caused the problem in the developing world because of failure to fulfill vaccine protocol. Even in the case of COVID now, we are looking at vaccines and saying, boy, it's going to be hard to get people in for a second vaccine, which is guaranteed. It's what guarantees immunity. And I heard a radio report the other day, they're talking about customer experience with vaccines, that if people have to wait, if the vaccine causes pain, if the vaccine causes any significant side effects, they fear people will not come and get that necessary second vaccine. So as a historian of medicine, I confess I did a small dance in my driveway, because this says to me there are other alternatives that we believe in vaccines, because they are the great history of medicine story of 1950 to the present, but they're not the only story. And so what I tried to stress in my little contributions to this book, was alternative narratives. The history of science and the history of medicine are always full of avenues that we have overlooked because they're not what we did in the end. And anyone who points out that I study alchemy would say I spend an awful lot of time looking at the things that nobody actually cares about. But I would say that the way that we look at the world, the way that we move forward, is not always made just of the choices that we adopted, but we must always consider the choices that we did not adopt or that we kept practicing while we adopted flashier ones. So vaccination has so much to recommend it. But in our greatest 20th century epidemiological crisis, HIV, it has offered nothing. Do you know what has solved HIV to the best extent of our ability? Condoms and PrEP and blood screening. That's public health. That's not the beautiful, flashy science story that gets you the Nobel. That's practical common sense. And so I'm here from my little non-medical standpoint to say that masks and gloves and antibacterial wipes might actually be our best defense against COVID, because I'm not convinced that vaccination is always and only the answer. So thank you very much for having me. I understand I'm a little bit the outlier, but it has been a great pleasure to work on this and to learn much more about the virology, which I certainly did not know very much about, and which my mom has become a tremendous expert in over the course of our working on this together. So thank you so much.
Well, I was thrilled when Allison was willing to participate in the book, because as she said, she provides a true historic perspective. And for those of you who read the book, it's that each chapter ends with her historic narrative. And this is true history, not my summary history of what happened, of the story of the virus, the story of the pandemic, and the response to it, but rather the elements that we learned from history. So it's a fascinating perspective for me that in each chapter. And then the other thing I wanted to talk about a little bit was the way we designed the book. I am a great admirer of two other science physician writers. And these are people very famous, both Pulitzer Prize winners, but just in particular, Siddhartha Mukherjee, who wrote Emperor of All Maladies, which many of you may have read. I was reading his book, The Gene, when I was trying to start writing this book. And I noticed that what helped me in his 800-page, very dense, science-heavy book was that he wove a personal narrative through the book. And that gave me the idea of starting each chapter with a short personal narrative that is directly linked to that chapter. So this is not something historians would favor, and not very many textbooks have something like this. But I think I thought of it as a way to give the average reader a window on how they might connect, because every one of us is, in theory, connected to infectious disease. And I didn't need those chapters because, of course, COVID came along. And now anyone who reads this book knows what it is like to experience a pandemic. But that's so the chapters are organized that way, with a short narrative at the beginning as an intro, then the text, which tells the story of the virus, the pandemic that it caused, the responses of medicine. And Allison is correct, there is quite a bit of a focus on the virus itself, because over time, I came to the belief that that is where the real solution is: knowledge of the virus, and therefore knowledge of how to prevent the virus and to get out of a pandemic like the one we're in. So Allison and I are ending up on the same page here, saying that things that we've learned about this virus have taught us already what we can do to prevent infection and to hopefully end the pandemic. So that's a lot of perspective from me on the book and on how we developed it. And now I'm going to hand off to Dr. Larry Chessin and Dr. Bill Valenti. These are both ID specialists here in Rochester, and they are going to ask us questions about the book and hopefully give you a little more perspective on it.
Thank you, Rae-Ellen. I went through this wonderful textbook and enjoyed reading it. I received it Wednesday night, and I didn't put it down till last night when I went through 334 pages of really well done exercise in viral diseases. I want to pick up on your point about vaccines, because this vaccine has been very helpful in eradicating disease, but we have three lessons we have to bring forth. One is the smallpox lesson. That vaccine actually has eradicated a disease. In 1987, Donald Henderson, who completed all the studies on vaccination, truly eradicated smallpox from the face of the earth. Polio is another story. Initially, Jonas Salk, who worked on influenza, thought he could conquer the polio virus situation, would have killed a virus. And that was used initially. And I remember in 1957, I was all of 11 years old then, living in Hell's Kitchen in New York, that we lined up at the local school to get vaccine because it was being released. And everybody was pleased because now we had a solution. Unfortunately, that went awry a little bit when Albert Sabin introduced the new oral vaccine, thinking they can get herd immunity very quickly by using a live vaccine, which would be excreted in various fragments through sewage, etc., and ultimately would eradicate the virus. But unfortunately, several years after the introduction of the Sabin vaccine, wild-type strains of that virus appeared, and cases of polio did appear. So here was a vaccine that worked initially, that was heat-killed, but when we switched to a variant of it, namely an oral vaccine, we had problems that surfaced. So now, currently, the ACIP, the accrediting organization for immunization, has taken Sabin vaccine off the market, and we've gone back to the classic heat-killed Salk vaccine as a means of eradication. And that leads me into COVID-19, which we're facing currently. Today, there are 4 candidate vaccines being proposed for solving the problem. The traditional heat-killed virus, a DNA-derived virus vaccine, which will be used to inoculate individuals, an RNA virus vaccine, and then a combined vaccine which has subsegments of the virus in the form of DNA and RNA. So these are the candidate vaccines, all of which are in trial now, and we'll have to await safety data, the fact that they produce neutralizing antibody, and be sure the side effect profile will be available so we can safely immunize the public.
One of the best things about the book for me was it was supposed to be submitted at the end of February this year. And at the end of January, the press asked me if I wanted to write a chapter about COVID, which was just emerging at that time. And that has been one of the most exciting things I've done in my life, is to follow the evolution of this pandemic as it happened. It was truly amazing. And at the beginning, I got information from newspapers all over the world, a few articles coming out of China, and then gradually more and more information. The book was submitted at the end of February. They let me write an epilogue in June. And my last sentence in the chapter on COVID is that we need to be ready. We need to be preparing. There are things we really need to do because this is going to be a global pandemic. June, there we are. It's everywhere. And ever since, of course, I'm still totally fascinated with this virus. And as a physician and as an epidemiologist, it's still really exciting to be in the learning curve. As a public health person, I have found this whole experience really discouraging because our public health measures have struggled to be effective.
This is a really challenging virus because, as opposed to having a single manifestation, as most viruses do, either being neurotropic, attacking the nervous system, this virus has the ability to not only attack the lungs, the heart, the GI tract, the kidney, the vascular system, the brain, the spinal cord. It has multiple clinical manifestations in its presentation, different in children from the adolescent, from the adult, and for the vulnerable older person like myself, it's a really challenging virus. And to get our hands around it is going to be a very difficult problem because it can shift and drift. That is, the genetic makeup of that virus permits it to undergo change. While the press hasn't brought this forth, the East Coast virus is quite distinct from the West Coast virus. And also, the local viruses, because of the nature of shifts within the genetic material, has produced molecular changes that we hope the vaccines will pick up on.
just to go back to the book for a second, people ask me, well, what is the thing that you learned that's, the most important? What's the biggest takeaway? I would say each virus dictates the disease, and conquering it means knowing that virus and exploiting its vulnerabilities. And we are learning about COVID, but we don't have all the answers yet.
I'm always reminded of an 1896 conversation at the College of Physicians in Philadelphia about tuberculosis. And I know tuberculosis is not a virus, but at the time it was one of the defining diseases of the era. And this is the most famous medical men of their day, from Hopkins, from Penn, from Harvard, and from Columbia. And they're all there, and they're debating whether there should be registration lists for tuberculosis patients, whether there should be a quarantine on houses where TB patients had died, whether there should be a ban on people with TB marrying and reproducing. And part of this discussion was about transmission. People knew that tuberculosis was a respiratory disease, and that it was caused by bacillus. Robert Koch had already established that. But these guys did not agree on whether it might also be genetic. Because of some eugenics principles, they noticed that it was very common among the poor. And we now know that that is because of where they lived and where they worked. But at the time, there is eugenics argument that says this is bad stock, that they had genetically bad lungs. And the reason that these gentlemen did not propose a registration list was because their wealthier patients would have also shown up on it, and they would have been forced into quarantine. All of this is to say, when we talk about disease prevention and we talk about better understanding how disease is transmitted, it is really worth considering the limits of what we know compared to the limits of what we expect or assume. So one of the great things about being a historian is we know that in 1896 there were socioeconomic assumptions about patients. But what are the socioeconomic assumptions that we're making now? Because, for example, we traditionally ignore diseases that affect women disproportionately to men. Here's a virus that disproportionately affects men. And I'm really interested to see how that difference might produce more valuable and more useful results. And certainly I understand that everybody is going full guns on this virus, but in 15 or 20 years, historians are going to look back and say, these are the assumptions that we made that framed our response, both in weakness and in strength. I think it's really important as a historian now to try to contribute to the conversation, not as a scientist. I'm not a scientist and I'm not a physician, but as somebody who knows how medicine is culturally constructed and culturally shaped. And that's really why I'm here, is to give some perspective from our past, and to say maybe we could do it better this time. Even if we don't, maybe we should have.
I'd like to open it up for questions from the audience. You can submit them in the Q&A. But first, I'd like to ask Dr. Chessin, Dr. Valenti, having read the book, what is the most burning question you would have for the authors? Or issue you'd like to ask about?
Do you have any questions for us that emerged from the book?
I do, yes. The past is prologue. I think that's very clear. So my question then is, what lessons should we take away from past pandemics to get us through COVID-19?
Well, Allison, you want to start?
Thank you. This is the biggest challenge that historians face, right? We're supposed to really have great answers. I think I would say our best response comes in public health driven answers. So although we're all a bit tired of wearing face masks, we know that they do protect other people and that they do limit the spread of this virus. And so that public health response can be taken directly from past public health responses to tuberculosis and to influenza, which is, of course, the 1918 precedent. when people stopped, so in 1918, there was this huge pandemic, and people were suddenly told they could no longer expectorate on the street. And there was a decline in the number of cases of influenza when that law was enforced. It had previously not been enforced. And so that tells me public health interventions, which seem small and simple and depend on people practicing their lives differently, when enforced, can have an extremely meaningful effect on virus transmission or disease transmission. The other thing I would say is public health efforts have traditionally been most effective when they were local. So if we take the example of 1918, the city of Philadelphia was ravaged by the flu, and it failed to produce a coherent public health response until 1920. During those 2 years, their caseload remained very high in waves as influenza occurs, but they never really did marshal a good response. St. Louis, Missouri was the opposite. They had a very high initial case rate. They engineered a significant and strict public health regime. They eliminated all public gatherings. They eliminated schools. They eliminated all but what we would now call essential workers, and their caseload plummeted, and they did not see the second and third waves that everyone else in the country saw. So I'm going to make a public health argument here and say that history tells us that enforced local public health responses work. To make them a national public health response, they must be consistent, they must be adopted, and they must be enforced. Thank you.
Yeah, I agree, absolutely. One of the things that I think about with COVID is how we have not had a coherent national program, and how easy it is for people to not respond when they don't have the information that they need. And in writing the book, almost every, HIV is such a good example of this, Dr. Valenti, is how learning that you could prevent infection made all the difference. And it was actually gay men in New York City who initiated the original use of prophylactics to prevent infection based on their STD experience. So I think every pandemic teaches us something important that we can apply now and in the future, because I firmly believe we're going to see another pandemic. This is not the last one. Any questions from the audience?
Yes, we do have a question. We have a few questions. To what extent do public policy and capitalist interests, particularly in the Western world, inflect responses or solutions to viruses?
Wow, I could talk for an hour about this. This is such a critical problem. Certainly right now, we see how incredibly capitalist influences are at play here in the response to this pandemic, and how rapidly Big Pharma is working to try to develop the vaccine, the treatment. And while it's good that they're so engaged, it's also purely from a monetary standpoint. So big issue. You know, one of the fascinating things in the book, at least really fascinating to me, was how all of the research for the polio vaccine was funded by the general public with their own personal donations. All of the research, all of the development none of it was government or industry funding. It was all the general public. And an amazing story worth reading in and of itself is that story of how the public were involved. Any other questions, Dan?
Oh, can I just talk about the capitalist thing for a second? So one of the things we always really need to consider in a global world is that globalism is something we assume to be necessary and important, but it is reflective of an increasingly global economy. So one example of how this virus has reflected global capitalism is travel. Many of you probably saw the New York Times article this week about how in March, people flew to Austria to go skiing, and they left with the COVID virus, and some of them went home and recovered, and some of them went home and died. And they're now suing that ski area because they're saying they should not have been allowed to travel there when there was a risk of transmission. So we take for granted that traveling for a vacation should mean we could travel to Holland tomorrow if we wanted to, or we could travel to the Caribbean on vacation, or we could travel anywhere we want because airfare is affordable and most people take advantage of it. The principle of traveling far from your home to enjoy yourself is a modern construction. In the period that I study, which is technically 400 years ago, people did not do that very often. They tended to spend most of their lives within 50 miles of where they were born unless they moved to a major city. So I would encourage us to think about the ways in which our assumptions about a necessarily global world drive some of our capitalist concerns or investments, and how those investments drive virus transmission. And just that one example, people traveling for fun, to go skiing, a lovely thing to do, no doubt, but they came home with a virus that they would not have encountered at the same time, given where they lived at the time. They were not from New York City. So thanks.
I just have to throw another thing in that I learned with the yellow fever, the ongoing epidemics. Yellow fever is still with us. And in Africa, the most recent outbreak, Chinese workers who were there only to work in the industries there from China, they went back from China, they went back home carrying that virus with them. And interestingly, no one got sick, even though these people were very sick and all of them died. So they were actively viremic, actively capable of transmitting the virus. And there's a mystery that's not been explained. Why has yellow fever never occurred in Asia? It's a disease that has occurred all over the world except there. So there as a transmission issue that's not solved. So of course I find all of this fascinating, but.
Thank you. Another question, aside from scientific studies, how does one get to know the virus, as Dr. Kavey suggests?
For me, it was just reading. And I don't discount reading that I did in things like Ladies' Home Journal and USA Today, because they cover things like this. The Guardian, I've come to really enjoy The Guardian because they cover medicine, they cover epidemiology in a very readable way, and that can give you access to it, to the science of the virus, which is a little more complicated. But once you get that basic interest, you can really go from there.
And I think it's important to try and understand contagion as a part of sorting these viruses out and understand the agents, how they're transmitted, because that drives how we stop virus transmission, how we stop the spread. Because HIV and corona, for example, are two very different viruses in terms of what they do and how they're transmitted. And I think we've spent a lot of time talking contagion over the years, Dr. Chessin and I, and realized that it's not an easy concept to grasp.
And it's different for each virus. I mean, there's a unique fingerprint that accompanies each virus, and sometimes we know the whole story or think we do, and sometimes we're involved in an evolving story ourselves.
It's important now that we have a national effort to deal with COVID-19.
I agree.
And that has not come forth. Unfortunately, our president has not been effective as a leader in this area. And that's one of the issues that the Infectious Disease Society of America is trying to tackle, that we have a national effort towards this virus, not just allowing different states to deal with it. I think the public should be alerted and speak up to this issue, because it's imperative that we have a unified effort and not have to, as with polio, depend on a march of dimes, but a national effort that crosses all the states, that we can deal with it. Because we have a wonderful CDC, despite our president's attack on Dr. Redfield. We have a wonderful NIH. We do have scientists, but we need an integrated approach at the federal level to deal with this virus and disseminate the information across the states, because that's the only way we can get to deal with it. Allison made a very good point about public health measures. They should be standardized, because at this point in time, hand washing, masks, and appropriate behavior is the only thing we have until we see a vaccine. But we need a standard statement from our federal officials regarding how to manage it. And that has not come forth.
It leads into another question we've had. Any comments on balancing economic factors with public health measures?
Well,
I think,
go ahead.
oh, sorry. I think one thing that we can take from the very positive response that everybody provided to the last question is the importance of a really valuable and consistent public health campaign. Because if we had a public health campaign that people understood and could manage, I think we could then have a stronger economic answer. But until people are able to understand how the virus is transmitted and their role and responsibility in controlling it, the push for economic viability is always viewed as competition to that narrative. I think they should not be viewed as competition, because in a world where we're going to be living with viruses rather than just defeating them and moving on, it is increasingly important that we understand how the economy can exist next to and with the viruses. And that requires a strong centralized public health effort, a strong centralized scientific effort, and a coherent public health narrative delivered to people so they understand what each household has to do. This is quite literally a fight alongside an enemy that is quick, it's innovative, and it often reacts faster than we do. And so we are always reacting, we're defending,
Reacts
while
faster.
it is always changing.
Yeah. But the other thing is, in the broader economic sense, it's very different. This is a difficult subject, but on the day-to-day basis, we're not talking about expensive measures that can help us deal with this virus right now. The measures, the simple hand washing, masking, and social distancing are not expensive. The problem comes when you try to continue all aspects of the economy and have social distancing. That's when the real difficulty comes in.
Meat packing plants being the most available example, right? They wouldn't shut them down. They said it was imperative that we had a meat supply for the country. And so they kept them going. People were standing much closer than 6 feet together. They were masked, but they were too close together. And so we see an explosion of cases in meatpacking plants.
And
well, was it worth keeping that sector of the economy going when what we needed to do was reimagine the way meat was packed so that we could do it in a way that allowed a meat supply for the country that would in fact necessarily cost more money, because we would be able to produce less meat per hour because there would be fewer people on the assembly line. But we would have saved a lot of people's lives. And so I think we start to see that the equation of the economy has to weigh people's livelihoods with their morbidity, with their health. And I don't often see that as part of the conversation in American politics, and I think it should be.
Good point, very good point.
So that brings into our next question. Given the political insertion in the COVID pandemic, particularly regarding the CDC, where do we look for facts about this disease?
Well, that is a good question, because the CDC has been having trouble getting their facts out. But I still believe that they have the facts and that they are our best source for them. As someone who reads the medical literature, that's another level of investigation that you can do if you want to. But bottom line, I think the CDC is still a reliable source of information if we could just eliminate the political interference.
Well, and if they would let Tony Fauci speak a little,
Oh,
because in the beginning he was really quite eloquent and did follow the science.
I agree. And now I don't see him very often anymore, but he is, many people would say the best source we have is Tony Fauci, best source for information.
Our next question: in the current absence of a coordinated federal government response and plan for combating COVID-19, how do we mobilize a coalition of medical and public health organizations and the public to fill the breach? In the comment, during the polio epidemic, it was mothers and fathers and PTA associations that went door to door to raise money for a cure.
In the historical framework in 1918, it was the American Red Cross that really drove flu efforts, as well as city governments. And the American Red Cross was the single overarching institution that united efforts across the United States. In polio, yes, single families did what they could, but let's be realistic. The March of Dimes was an extremely well-funded effort that used public cinema venues to collect donations, and it was a very effective way to do this. I mean, those film strips were powerful narratives that drove a particular message about polio, which was that these very sick children could be resurrected and learn to walk and gain full mobility again. And the promise of these always white, always blonde children once again being able to rise from their beds was an extremely powerful one. For COVID-19, we have a federal government that denies science as an epistemological approach. It denies the validity of scientific thought and evidence-based argumentation. And we have no single federal agency that has been able to out-yell the current commander-in-chief. And so I don't see the potential for a single federal response until we have a president who is willing to accept that science and evidence-driven argumentation are the only valid way to approach any problem, never mind a specifically scientific problem. That rational thought must always be valued. And until we, as a nation, stand back up for rational thinking and logic, I do not see a strong national level response in this country. We have too many people who reject that what used to be an assumption in the 1950s, science was king. It was the unquestioned means of answering problems. There were problems with that too, but not as many problems as we have with what has traditionally been called magical thinking by people who don't study magic, which was a logical and rationally driven system in the 16th century. But now this is wishful thinking. It's, I want to return to the life I had before February. Well, yeah, me too. But that doesn't mean that you can. And that's what we need to change in this country. Sorry, small rant.
So we have time for one more question. Question is, will you be writing a sequel just focusing on COVID-19?
actually, I'm so fascinated with this virus that I could write another book on it. But at the moment, I'm not.
Any final thoughts from our panelists?
I just want to thank everybody for coming. It was really very helpful to have Dr. Valenti and Dr. Chessin here. Dan, you did a great job organizing this. And of course, always happy to have Allison.
Well, thank you very much to everyone. It was a really interesting and enriching discussion.
And thanks to everybody for listening.
Yeah. Thank you and good luck. Face masks. Face masks.
Stay safe.
Bye-bye.
Thank you.
You will.
Yeah, thank you to Rae-Ellen, Allison, Dr. Lawrence, and Bill Valenti. Buy the book. I've put the link to our bookstore in the chat. You can click there for curbside pickup. For more information about writers and books, wab.org. And thank you, and we'll see you next time.
Thanks so much. Bye-bye.
Take care.
Bye.